Understanding America's healthcare system, how it works. Today, we're going to talk about something that affects every one of us, healthcare. America's healthcare system is unique compared to many other countries. Unlike places with national health insurance, the US system is a mix of private and public programs. The healthcare system involves three main players: providers, settings, and consumers. Understanding how it all works helps healthcare workers see their role clearly and helps consumers understand what affects the cost and quality of their care. Let's start with providers, the people who deliver care. This includes doctors, nurses, technicians, therapists, pharmacists, and dietitians. They work in various places such as hospitals, clinics, and rehab centers, using their training to help prevent illnesses, diagnose problems, and treat patients. Preventive care, like vaccines or health screenings, is key to helping people stay healthy and avoid serious illness or disability. However, healthcare providers also have a big responsibility regarding fairness. Implicit bias can sometimes affect how care is given. Healthcare settings. There are two major types of care settings: inpatient and outpatient. Inpatient care. Inpatient care means overnight stays, such as in hospitals. It's expensive and limited by what your insurance covers. If you're uninsured or live in a rural area, your options shrink fast. But public hospitals and charity programs offer care no matter your income. Outpatient care. Outpatient care is where most day to day healthcare happens, like checkups, lab work, and mental health therapy. You're in and out the same day. The challenge: many outpatient centers don't accept Medicaid or are too far away, especially for rural areas. Community health centers and federally qualified health centers specialize in serving underserved populations. Now, let's talk about one of the most important and honestly most confusing parts of the US healthcare system: who pays for what? Public insurance includes programs like Medicare and Medicaid. Medicare is mainly for people over 65, and Medicaid is for low income individuals. Workplace coverage is when your job offers healthcare coverage as a benefit. Your employer usually pays part of the monthly premium. Private insurance, purchased individually, includes buying a plan through the marketplace or directly from an insurance company. In 2023, the average employer based insurance premium for a family plan was almost $24,000 a year. That's more than many people pay for rent or mortgage. In 2022, about 27.6 million Americans were uninsured. Without insurance, you pay the full cost out of pocket, and it can be shocking. A single ER visit can cost over $2,000. A 3-day hospital stay could cost more than $30,000. And without insurance, you don't get the benefit of negotiated rates. Costs vary based on the provider and location. Insurance helps reduce inequity by improving access to preventive and specialty care, but not everyone has access. For the uninsured, the consequences are serious. People often delay or skip care altogether because of the cost. A study by the Institute of Medicine estimated that tens of thousands of preventable deaths each year are linked to lack of insurance. At the end of the day, how we pay for healthcare plays a huge role in determining who can access it and who can't. The US healthcare system is capable of world class care, but it also has staggering inequality. Understanding the system is the first step towards changing it. Knowledge is power, and with it, we can push for a system that's not only smart, but fair.